I'm Michael Snelling, I'm a physiotherapist, sports physiotherapist in private practice. Functional movement, obviously really important in ACL rehab. I think even more important is obviously in prevention of ACL injuries. And when we start talking about prevention of ACL injuries, what I'd love to see is functional movements being reintroduced, I think, into the youth. I think if you look at some of the young sports people around, and even as young as 8 to 10 years of age, I think they've lost a lot of functional movement, even primitive movement patterns. I don't think kids are doing the sort of things that they used to maybe 30 or 40 years ago. And when you have a look around at kids participating in sport, I think their functional movements are really poor. And I think if we can improve the functional movement patterns of our youth, it may play a big part in reducing ACL injuries when they get further on down the track even into professional sport. It goes back to the physical education of children and us teaching and coaching them proper movement patterns. I think we've moved away from really raw teaching and coaching, and we need to get back to that. It's about addressing a number of different areas and accepting how people learn to move. Some people it's all through vision, other people it's through feeling. So we've got to use all of those senses, and we've got to identify how kids and how our athletes learn and tap into that and teach them either through the use of visual feedback or through the use of hands-on kinesthetic feedback. And we need to be able to get back to that to try and teach them better movement patterns. Everyone's got access to video, even through smartphones and iPads and the like, and we can use those with the amateur or sub-elite people and tape them doing a certain movement and give them immediate feedback on what they're doing, and I reckon we'll see a big difference. Something that we've looked into over the last 5 years is really this arthrogenic muscle inhibition. So it's this inhibition that occurs following an ACL injury where the receptors in the knee have been damaged, and that actually causes a change in the pathway back to the brain, and then the brain actually not sending the messages further down into the leg. And fundamentally you get a quadriceps weakness, and sometimes that weakness has been shown to be there for up to 2 to 3 or 4 years. Some people, they don't even get it back, and I think we really need to focus on that, make sure that their strength comes back as much as they can. And it's not necessarily just through voluntary exercise. I think we need to help them. There might be some neuromuscular stimulation exercises that we need to do, and we need to focus on that and make sure that as soon as the player is ready to return to their field of play, that their strength is back and they don't have any of this quadriceps weakness. I personally have been influenced by Bill Knowles, a practitioner, an athletic trainer in the US, and he uses functional electrical stimulation on the quads and does that during functional movements. He might have them on the bike and the machine is on their quads twitching away, might do squats, they might be in the gym doing any sort of exercise, bounding, whatever you want, and that's there to help facilitate that muscle contraction. And the world's your oyster with regards just imagination. You can use it however you want and make it as functional as you need to, depending on the athlete. One study did reveal that dancers and ice skaters have a very low incidence of ACL, and I think that's probably related to the fact that they don't do too many unanticipated movements. Everything's choreographed, and everything they're going to do is pre-planned. Unlike in football codes, there's a lot of unanticipated movements, and I think the only way that you can try and counter that is just expose the player to as many of those movement patterns as possible and just get repetition after repetition, and hopefully then that transposes into that unanticipated movement where they've got their self or their foot placement in the right position to minimise the risk of injury.